People always ask me, Pratica Informagem, which book should I buy? Which books should I buy? There's the Bible of nursing, right? Bible in the sense of a book that has everything. Anyway, guys, there are some books that I recommend. If you say, I'm not having much money, but I want to buy a book or books for. It's not even to build a library, but it's for me to consult, to help me with my studies. Anyway, I'm going to recommend some books here. Okay, guys? By the way, don't forget to like, share, and subscribe. Help us out in our daily work by sharing the information. I'll be really happy with your support here. All right, let's go. Guys, by far, the first book I'm going to recommend to you is a book for you to speak. That way, it solves pretty much almost everything I need for nursing care. It's not a book that's going to help you with basic subjects. What would the basic subjects be? Anatomy, physiology, biochemistry, pharmacology? I'll talk about those books at the end. The book I recommend now is Fundamentals of Nursing by Potter Perry. They're two people, right? And of course, there are a ton of other contributors to the book. I really recommend this book. I have 2 copies, right? I have the last 2 editions. It's that thing, right? Every time there's an update, I even buy it to see what changed from one edition to the other to create content. But if you already have one edition, you don't need to get the latest one like, oh, I have to buy the newest one again. It's not a book that changes that much. And also just follow along here. So, if you have a book from the previous edition, every time a new version comes out, I buy it and make comparisons here about what's changed. So, in other words, if you're here, you'll stay up to date with the changes. So, you wouldn't need to buy another book. I don't remember the book's price off the top of my head, but where? I recommend that you buy this book at the cheapest place you can find on the internet and that you use a credit card to buy it. If it's with PIX, well, if it's a bookstore you already know, you can pay with PIX if it's a really cheap place. If you found the book at a place you don't know, buy it with a credit card. Because if this book never arrives for you, you can talk to your credit card company, prove that the book never arrived, and get your refund. PIX. It's a bit more complicated at this point. Usually I buy from the cheapest place. I'm not going to recommend any place. I don't get paid to recommend any place. Anyway, I don't sell anything, so what are you going to look for? The book from the latest edition, let me see here which one is the latest edition. 11th edition. The 11th edition is the latest one we have. I don't know when the 12th will arrive. I'm not worried about it coming soon, or I'll have to buy the other one. But it's a book, man, that will really help you with your nursing questions. So it's a book so you don't have to depend on artificial intelligence, Google, or something else to get information or get wrong information. There's a lot of content there. Actually, it has everything you need. For nursing care, it's for both nurses and technicians. If you're a technician, you won't do the nurse's activities, but the information is there. If you want to read it, there's no problem. But remember, it's a book for nursing, not just for nurses or technicians. It's for nursing as a whole. So, if you're a nurse, the book is perfect for you, just as it's perfect for nursing technicians, okay? I don't have the second book. Personally, I prefer the one I just recommended to you. But there are also excellent books like the Brunner collection, which includes surgical nursing and so on. They're books as well, right? I don't know how it is today. I don't know if it's 4 books, 4 volumes. I know that now it's just 1. Honestly, I don't have those books. Personally, I prefer the language used by Potter, but that doesn't mean the other one isn't very good. It is very good too. It's just that I can't have everything here either. So I preferred, since my undergraduate days, to stick with Potter's language for my education. So right, I'm just sharing my own experience. If you like Brunner Sudarte, I don't know how to say it properly. Go ahead, you can buy it with your eyes closed. It's excellent too, okay? There are other books that you have to consider if they make sense for you. So for example, these are the books. For those who are short on money, buy one or the other, or if you can, buy both. You will get similar information with slightly different perspectives, but good ones. But I have more money. Professor, I'm fine. I want to buy more books. What do you recommend? If you are a nurse, buy books about that, but a good book about that you will get. Let me see. The book about that is not here on my shelf. They're using my book, the book about that. I'm going to ask to leave this book in the picture here. The one you're seeing there, this book, it's a good book. I've used it in all the editions. Remember that it's a book about that, not just about the nursing process itself, okay? So it's going to help you understand the whole process of that. Electrocardiogram. If you want more, there's the Laryngenia, which uses simple language, but you're not going to learn how to interpret ECGs, you'll learn how to identify them. I'm saying this because I use part of this book and other books and several electrocardiograms in my electrocardiogram interpretation course for nurses. And I say this. This book helps you identify, it doesn't help you interpret, it doesn't give you much reasoning. If you want to buy my course, it has about a 200-page book with a 12-lead electrocardiogram. Anyway, the course is good. The book that's included in the course isn't sold separately. It's a package as well. You will actually learn how to interpret. There, you won't go because of me. I've studied this book a lot, and it gives you a foundation, but it doesn't give you a foundation to make associations and interpretations. You would need other books, but it's still a good book for beginners, for those who want to understand the basics, what a QRS complex is, what a wave is. So it's very basic, it helps, but it's really basic for the basics. I don't recommend that you don't. If you buy anatomy, physiology, biochemistry, or pharmacology books, I don't recommend that you buy them because you won't read them. Ada, but I want to have them on my shelf. Oh, I see. So you buy anatomy books. Usually there are 2 volumes. Buy an anatomy atlas. If you're going to buy a pharmacology book, whichever one I recommend to you, the reading will be quite complex. I love Hangdale. Some people hate Hangdale, but the Hangdale pharmacology book is the one I have here, man. It's really good. Physiology. I use Guyton Hill, the little Guyton, the famous Guyton, but there are other books too, like Silverstone, which is also very good. They have different styles, and some people find Guyton harder than others. You need to find what works for you, just letting you know. Most people are able to read these books, and that's really good. When you're at this stage, I'm currently in the physiology phase, and you're following the classes with the book. After you've gone through physiology from scratch, maybe you won't have the patience you need, and so on. With the basic books, they're excellent books. Do you want to build a bookshelf? I strongly recommend that you buy these books. Get the brands, the best publishers. Among those brands I mentioned, Arte Media is very good, Guanabara Kugam is very good. Ateneo, Elsevier, man, there are many very good publishers. Manole is very good, so these are publishers I would recommend. Because man, they would never put a book on the shelf with that publisher's brand, alright?